Hey girl, what are you up to today?
Oh, not too much. Just hanging out at home. A little vacuuming going on. How are you doing? Is Logan home today?
Unfortunately not. He's at work today, so here I am putting together this baby crib all on my own. Where do you think he'd keep the extra nails in the house?
My guess would probably be in the garage.
Of course. I'll go take a look out there now. I gotta get cracking on this baby crib, so I'll let you go. Talk to you later. Love you. Bye.
Okay, sounds good. Love you, bye.
I wonder where the nails are. They gotta be in the toolbox. Oh. Oh no. Oh.
One week later.
I'm not really sure what's been going on lately. I have a super sore neck and all the muscles in my body have been really stiff and I just don't know what's happening. I haven't really done anything other than put together that crib last week.
That's really weird. I would get that checked out. Like, you never know what's going on with the baby, and better safe than sorry.
See, Abby, I told you something's going on. It hurts so bad to swallow. I don't know
That
what
was
to
really
do.
scary. I'm gonna take you to the hospital right now. We gotta get out of here.
Let's go.
Come on, Mama.
Abby, how far are we from Rinker Memorial Hospital?
We're just a few minutes. Hold on.
I'm so mad I couldn't eat that Highland.
All right, Paige, we're ready for you to come back. We'll just take Paige for now, just to respect patient privacy. I hope that was okay. I wanted to respect her patient privacy, so I didn't want to bring her back.
Yeah, thanks for doing that. I love Abby, but I'm just not sure how much I'm willing to share with all the uncertainty of what's going on.
Sounds great. Okay, you can take a seat, and then we'll begin your vital signs. All right, let me just take your vitals real quick. All right, so it looks like your blood pressure and your temp are pretty high. Is that normal for you?
No, that's really weird. Normally low blood pressure runs in my family.
I see. So what brought you in today?
So I've been having a really stiff neck and sore muscles, and I haven't even done any extraneous activity. The most I've done is put together my baby's crib last week. But I also have noticed having difficulty speaking a little bit, and then today when I was out, I couldn't swallow my food.
So that's not good. Did you notice anything while you're building the crib?
Well, while I was building it, I had to find some nails in my husband's toolbox, and one of them scratched me really bad, but I didn't think anything of it.
All right, so that brings me to my next question. Are you vaccinated for tetanus?
No, my parents were kind of against vaccination growing up, so I just, ever since being on my own, haven't really looked into it. I've been healthy otherwise.
Okay, that's good. All right, so thank you for sharing. I'll just let the doctor know and we'll be back with more information.
Perfect.
Hey, Dr. Hartwig.
Hello.
So this is our next patient, Paige. She's a 26-year-old female. She presented with a scratch on her hand from a nail. So here's her chart.
Okay.
She's 6 months pregnant, so that's a little bit of an issue. Yeah, considering that she's not vaccinated for tetanus, I was thinking tetanus. What are your thoughts?
Yeah, no, definitely. Let's take a look. That certainly sounds plausible. Why don't we head back in there and ask her some more questions?
Okay, sure thing. I've never actually had a patient with tetanus though before. Could you just explain how it manifests to me again?
Yeah, absolutely. So it really isn't something that we see all the time. Here's how it works. When a tetanus-infected object causes a wound, there's a bacteria that produces spores, which is Clostridium tetani, and that enters the bloodstream through the wound. The tetanus toxins then enter the nervous system from low motor neurons, and they travel up to the brain and spinal cord. It causes painful muscle contractions because the toxin interferes with the release of inhibitory neurotransmitters. This in turn compromises the nervous and the musculoskeletal system together, which gives the symptoms that we commonly associate with the disease. The good news is that it's not transmittable from person to person.
Wow, thanks. Let's get back in there.
Come in.
Hi, Paige. How you doing?
Good, how are you?
Good. My name's Dr. Hartwig. I'm one of the doctors here at Rinker Memorial Hospital. I understand that you're coming in experiencing some painful muscle contractions, stiff neck, and difficulty swallowing and speaking. Kaylin also shared with me that you scratched your hand on an old nail and that you're not vaccinated for tetanus. So based on these observations, it sounds like you've been infected with the tetanus toxin. Do you mind if I take a look at the hand where you scratched yourself? Oh yeah, very hot. Your hand definitely appears to be infected, and along with all of your other symptoms, I can confidently diagnose you with tetanus.
How can you be sure? Is there some sort of test you can run?
Yeah, I can certainly hear in your voice that you're struggling to speak, and unfortunately, there are no diagnostic tests that we can run to confirm the diagnosis of tetanus. Based on your physical exam, medical history, and signs and symptoms, that's what we clinicians use to diagnose tetanus, which all the information that you've presented is pointing to that diagnosis.
So what happens now? Is it just going to keep getting worse or will it go away?
The honest truth about this disease is that it has no cure. The disease has to run its course, and within the next couple of weeks, you're going to experience symptoms such as seizure-like contractions, spasms, sweating, fever, rapid heart rate, and things like that.
Can anything be done to help?
We can take care of the wound on your hand and make sure that that's clear of the infection. And then there are different medications such as antitoxins, sedatives, antibiotics, and other medications to help with the symptoms. We should do one thing though right away, which would be to vaccinate you for tetanus today.
Is the vaccine going to hurt my baby? Because if it is, I'm definitely not getting it.
So I feel it'll be safe for the baby and yourself to get the vaccine.
Yeah, in fact, there's actually a recent research study done within the last year that confirmed that the tetanus, diphtheria, and acellular pertussis vaccine was safe for women to have after the 27th week of pregnancy, which you have already far surpassed.
Okay, that's a relief. I certainly would like to get the vaccine right away and start my medications as soon as possible.
Sure thing. I'll call on those medications for you right away, and we'll get you started on the effective treatment regimen that we talked about, and Caitlin here will be able to administer the vaccine to you right away today then.
All right, one last question though. How long will these symptoms last for?
That's a good question. They can last up to 3 to 4 weeks and for as long as several months. It's a long road, but the medication should be effective in managing your symptoms. The toxin doesn't do any permanent damage, thankfully, and with the right supportive care, you should be able to make a full recovery.
Awesome, thank you.
Absolutely.
All right, so I have the vaccine right here. I'll just administer this to you right now. A little pinch. All right, you're all set. Let me walk you out.
Thank you so much for your time and help.
Of course.
Bye, Paige. Hope you feel better.
Thank you very much.
Yes.
All right, Abby, let's go.
What happened to your voice?
We can talk in the
Are you
car.
okay?
Yeah.
Oh, jeez.
Hey, Abby, will you take me to Walgreens?
Oh, yeah, of course. Like, Paige, like, what even happened in there, though? Like, what's going
Remember
on?
last week when I had to build that crib?
Yeah, you sound bad.
Yeah, I cut
Dang.
my hand on a nail,
Oh,
and
jeez.
I'm not vaccinated for tetanus. So
Why?
I know. So they said I got tetanus.
Okay.
So that's why my voice is getting bad, and they
What else
basically
will happen?
They said it's just gonna get worse from here.
Oh, gosh.
But I have to wait it out.
So why are we going to Walgreens?
So they gave me the vaccine. They said it
Yeah.
was safe for the baby.
Oh, good.
Yeah.
Good.
And then they're starting me on antibiotics to kill the toxin.
Yep.
Uh-huh.
Okay.
So I just need to pick those up. They sent them to Walgreens.
How long do you take those for?
Just like a week or two. I'm not
Okay.
even sure.
Oh, okay.
They
The
just-
pharmacist should tell us.
Yeah, they'll send it in.
Yeah.
So,
Okay.
yeah.
Oh, geez. I'm glad you're getting taken care of.
Thanks,
And I'm
girl.
glad the baby will be safe.
Thank you.
Yeah.
2 weeks later.
Abby, my muscles are so tense I can barely move. It hurts so bad.
Oh, geez. This isn't good. How long did the doctor say this would last?
The doctor said like 3 to 4 weeks the symptoms will last.
You know, Paige, you're going to be okay. Just try to ride out these symptoms. I know it sucks, but in a few weeks you'll be all better, and then you can have your beautiful baby girl.